Our country is once again arguing about ways to slow down or stop the gun violence that is taking lives at an alarming rate in our country. Much of the discourse gets caught up in political spin to the benefit of one side or the other, but there are facts about what's happening, and we're going to talk about some of them this morning. Dr. Sandra McKay is a pediatrician and is in fact an associate professor of pediatrics at McGovern Medical School at UT Health Center in Houston. Her career-long focus on child health advocacy has led her to the Baker Institute for Public Policy, where she's a non-resident fellow with the Center for Health and Biosciences and a focus on firearm injury prevention and safety. She's a perfect guest for such a time as this. Thank you for being here.
Thank you for having me.
So June 21st, you've got a symposium coming up. Baker Institute is hosting the symposium, and I like the title of it. Is the Preventing Firearm Injury in the Houston Area Through Purpose and Policy. What kinds of facts are you presenting, or in general, that you hope are going to be help to affect policy?
Yes. So what we've done is we've brought together a collaboration of experts that are here locally, both in Houston and also in our region, to look at some of the data that has been come out in the local Houston area around where are the injuries, where are the firearm injuries happening both here locally, and then also what are the programs that are happening here in Houston and also in the local Texas area. Some of the work that's being done by our researchers, by our community interventionists, and what are the things in the programs that are intervening right now.
And these are all factual information as well, so
Yes.
It really takes it out of the political sphere, doesn't it? There's no spin going on here. We're talking about factual presentations.
Actual facts, presentations, what's happening in Houston, what is the work being done, what is the community doing, and how are we responding to the needs of our people.
Uvalde murders, they put a spotlight on the deaths of children, certainly in a horrific way that no one really wanted to see, from gun violence. And we talked earlier, before we did this interview, where do children's deaths by firearms rank now in this country, and how concerning is that to you?
Right now, firearms are the leading cause of death in children, surpassing motor vehicle accidents. It's horrific, it's scary, it's intimidating for parents and for families. And this is something that is not new though. This started back in 2017 is when we really saw that crossover from motor vehicles to being firearms being that leading cause of death. And it is something that is predictable, preventable, and it's something that we as pediatricians have been sounding the alarm on. And we've been working towards trying to implement programs and policies that we can help reduce firearm injury and death in children.
I'm amazed at the amount of money that's not being spent on this. I think you probably are in the same chorus with me on that one, in terms of the money that the government gives to help look into firearm kind of injuries is really tiny compared to some of the other things. You have an example of how that is just out of whack.
Yes. So the current funding from the CDC and the NIH is about $25 million that they've invested in firearm injury research, right? You compare that to what they spend hundreds of millions of dollars in cancer research. The total funding for the NIH in general is over $40 billion. So it's a drop in the bucket for what they spend on firearm research. And they've only recently started funding firearm research. And this was only back in 2019. So we are way behind the 8 ball in our funding for research.
And why do you think it took so long? Was that just politics, or was it just the priorities rising to a level where politicians saw fit to make that available?
So a lot of this came back from the Dickey Amendment from 1996, which really put out a policy saying that they don't want to fund research that will lead to gun control mechanisms. And so it put this veil over, is it okay for us to fund research related to gun violence interventions? And what this is we're really not doing research to sit there and say we should control firearms. We need to understand what are the mechanisms behind what is causing these injuries and deaths in children, because there are a lot of policies that we can put into place that can reduce injury and death in children, that can really, improve the health and safety of our lives of children. Very simple ones like, making sure that safe storage is in place for children that can save lives, but not infringe upon the rights of our firearm owning families either.
So it kind of takes it out of the political realm when you start talking about some of those things that do make sense, but even those things that you say do make sense, they're not in the law at this point.
Yeah.
And so hopefully you and the policies you put forward with facts, you hope to make, is that kind of what you're there for, health and biosciences, to kind of put forth this information so those who make the policy can at least see the facts to make them?
So we'd like to be able to bring forth the research and the evidence to help guide evidence-based policies. So that way when we have good evidence, we can have good policies that will then be translated into something that can save lives and help keep children healthy and safe. And that is our ultimate goal.
Well, we're going to continue our conversation with Newsmakers Extra because we have more to talk about. But right now, I'm going to put the information about the symposium on the Newsmakers website as well. I really enjoy and look forward to the results of more research that's coming out since it's relatively new, since 2019. So, Dr. Sandra McKay, thank you so much.
Thank you so much.
All right.